Let us start our science class. Okay. Before going to the lesson, I will ask you one question, student. How you all? How are you? Is what you are saying to me, what you are replying to me is fine or is well, good. Yes. Now, the same question I will ask with a grandmother or grandfather, what he or she will reply to me. What she will say? Yeah, I am not feeling well. She will say, sometimes they also fine, but sometimes they will say, I am not feeling well. What they will say, the reasons is leg pain or is fever, headache, throat pain, like that. Many names they will say, many symptoms they will say. Yes, surely if I am going to ask the same question in rainy season means, what you will say? Yeah, in our class many students, they are taking leave many days and alternatively they are taking the leaves also. Then they are saying, ma'am, I am not feeling well. I got fever or else throat pain. Many reasons, many symptoms, many names you will say. Yes, right? Yeah. Now tell me why you are saying such a reason, student? Why you are saying such a reasons? Ma'am, I am not feeling well. What happened to you? Why you are saying like that? What it means you are not feeling well means what it means? Yes, what it means? Your health is not good. Sometime what you are saying, ma'am, yesterday night I didn't get sleep. Because of that I am feeling tiredness today. Sleepy mode today. I am not feeling well, you are saying. See, that is what it means. Your health is not good. Your health is not fine. So, you have got some disease. Now, tell me, student, what is your health? Yes, you are saying that my mother's health is not good, or else my grandmother, she is suffering from some disease, so her health is not good. Now, tell me, student, what is this health? Yeah, what it is health? Generally, we are saying if you are not feeling well, we are saying my health is not good. Now, what is that health? It is a state of being well enough to function well physically or else mentally and socially. So, health means if our health is good means what we are doing? Physically we are healthy, mentally we are saying I am good. Upon that, socially we are mingling with others, we are saying socially we are good. Okay, so now health means what? Health, it is a state of being well enough to function well physically, mentally and socially. Yes, this is a health. Now, what about the disease? Health is not good means? It means you are suffering from diseases or else some illness you have. Now tell me, student, what it means, disease? Yeah, any disturbed case, any uncomfortable state it is, any uncomfortable in your, if it is mentally or else physically, same as that, in socially you are not good. Disturbed case. One example I will say, student. Yesterday night I didn't get sleep. Means what? Today you will feel some uncomfortable or else undisturbed. So, disturbed case you will. Disturbed case it is. So, surely your health is not good. Or else if any other cough or fever if you got means your health is not good, you are saying so, that is I got some disease. Yeah, these are the some things what it is. If our health is not good means we are calling that person he is ill or else he is suffering from disease. Okay, being uncomfortable, one or more system of the body will change and give rise to the symptoms, that is a disease. What happens to our body? If our cell is damaged, if our cell is not feeling comfortableness, then what will happen? our body, entire body, we know that there is a connection between the cell and our body. If one cell is not good, sometimes the tissue is also not good. If tissue is not fine, means what will happen? It is not working properly, means what happen? Organs may damage. If organs are damaged, means entire organ system will damage. If entire organ system damage, means what will happen? We know that there is a connection between the organ system present in our body. If it is a circulatory system, there is a connection with respiratory system, digestive system, like that. So what happened finally? Entire organism or else entire body will get that disease or else that disturbed case it is. So that is called as disease. So you know that if disease means how we are saying that person he is suffering from any sick or else any illness. How we are saying, how we are come to know that he is getting disease or else he is suffering from disease. How we are come to know? By seeing only we can say you are not feeling well. Sometimes we are asking with our friends. By his appearance only we are asking what happened to you, yeah? Why you are not feeling well? So what it means, we can by external look only it tells us that he is not feeling well. Yeah. Now sometime it is we are getting some symptoms. What is symptoms now? What it is symptoms means what? Symptoms means some characters, okay, something it is indicates that he is not feeling well. Symptoms means like if you are getting fever, your body temperature will high, shivering, these are the symptoms. If you are getting common cold, what will happen? Sneezing, coughing, fever, runny nose, all those things are the symptoms, okay. Come to know what is symptoms and what it is. What is a disease means what? What is the difference between health and disease? Okay, it doesn't mean that only a fever if you are getting, you are saying that disease. If it is a mentally she is not feeling well, disturbed case, pressure is not working properly, pressure difference, what a fluctuation in the pressure, if it is decreasing or increasing, that is also a disease only. Okay, so come to know now what is the difference between health and diseases. Now any disturbance in the structure or functions of any organs or else any part of the body. If one example I will say, student, your hand got fracture or else like just imagine like that. So whether we can say that is a healthy person? No. Because if any damage in the body or else if it is in the cell level, it may be, we can call it as a disease, okay, or else he is not feeling well or else he is suffering from diseases. Now my question is here, why do we fall ill? We come to know that what is illness. Now here the question is, why do we fall ill? Why we are getting these different diseases? Why it is? Say my friend, he is having fever, he is suffering from fever, but I am well or else I am good today, my health is good. Why he got fever? What is the reason for his fever? Okay, in today's class we are going to study the answer for this question, why do we fall ill? This is a heading of our chapter. Write down the heading, student. Why do we fall ill? Okay, why do we fall ill? Now we come to know that what is the difference between healthy person and diseased or else healthy person and someone suffering from diseases. What? Now what are the differences? Yes, healthy person means his functions, being well function, enough function, he is mentally or else physically or else socially he is good. Okay, it is a state of being well enough to function well physically, mentally or else socially. Diseases means what happens? Something disturbed case. If it is mentally, physically or else socially. Okay. Now, do you know how we are getting diseases? How we are getting diseases, students? In rainy season we can see more and more symptoms, more and more diseases Nowadays it is a fashion, like see other fashions, in one season we will get one name disease. For next year the name itself change. After that one more diseases. See, once the chikungunya, it was very famous disease. After next year what happened? Ebola. Next what? Malaria. After that many diseases like elephantiasis, all those things. Now it is very famous. For last year Nipah it was. This year after 2018 it is now what happened? Now it is a season of coronavirus, that is a COVID-19. See student, it is like a fashion. Diseases also, new terms will come. Now latest note, that is a Shigella bacteria, it is going to spread rapidly. Upon that, nowadays we are hearing that mutationed corona, once again it is also spreading like anything. So it is fastly spreading. So all we will discuss in this chapter. Under this chapter we are going to discuss all the different names of the diseases and how they are going to transfer from one person to another. Okay, all those things we are going to study in this. Now, diseases may be caused due to the attack of pathogen. Do you know what is this pathogen? Pathogen. Diseases may cause because of the attack of this one pathogen. Pathogen means nothing but it is a microorganisms. Any microbes, if it is a virus, bacteria, protozoans, fungus, all those things, okay. So those organisms are called as pathogen. Okay, pathogen. Next, what happens? Sometime we are getting diseases because of this pathogen. Sometime lack of nutritious diet, it is also leading to some illness. Okay, or else balanced diet. Because of the balanced diet, sometime we can, because of the malnutrition, we will get some diseases. If it is a vitamin deficiency, we know that night blindness, xerophthalmia, upon that many diseases are there students. If rickets, scurvy, many diseases. Okay, that is because of our vitamins or else our nutrition, the lack of our nutrition. One more thing, lack of public health and hygiene. Because of the hygiene, if you are not clean or as our surrounding is not clean, if it is dirty surrounding means surely there is a surely we will get disease because of the pathogens or microbes. Okay, sometimes because of the genetic abnormalities also there is a chance of getting diseases. We will discuss later what is that. Okay. Now these are the some of the ways I said how we are getting diseases. Okay. Next, this if you are going to speak about the pathogens means what? We come to know that virus, bacteria, all those things. There are number of subdivisions in that. If it is bacteria, there are number of different bacteria, like in 8th standard we studied, that is if it is round shaped, rod shaped, spiral shaped, clusters of together, organism together, there is a different types of bacteria are there, same as that other organisms also. These are responsible for the diseases, they are giving diseases to us. Okay. Next we will see student, diseases are divided into, mainly diseases are divided into two types. Okay. On the basis of time duration, how much time it will lead. Okay. If one person he is getting diseases, mean how many days we can see the symptoms or else it is there in his body. Okay. The classification is based on what here? Time duration. So diseases are mainly divided into two types, that is acute disease and chronic disease. See, first one is acute diseases, one more is chronic disease. One is acute disease and one more is a chronic disease. Now we will discuss one by one what is this first one, acute disease means. See, acute disease means here some diseases are already we said that it is by seeing the time duration. So what happened in acute diseases, these diseases are last for only short period of time. See, one example I will say, student, if we are getting or as if you are getting common cold, what will happen? How many days it will remain in your body, or else how many days you are showing the symptoms? Yeah, surely maximum 1 week or else less than that, or else sometime 1 or 2 days changes. So here see, acute disease means what happened? The time duration, once the disease will attack us and after few days it will leave us. So these such diseases are called as acute disease. Come to know now what is acute disease. So time period is very short here, very short term disease it is. Short term disease is called as acute disease. Can you give example to this acute disease? Yeah, we can see number of examples. Almost we can see many diseases example for this only. If it is influenza, that is a flu. One time it was very famous. Nowadays we can't see more because of the what vaccines and all, medicines, antibiotics, all those things. Because of that nowadays it is not that much common. See, this is one type of disease. What happened here? Once we got diseases, it will last for few days and it will go, we will recover completely. We will recover completely. Okay, next one more. Can you give more example to this, students? If it is a common fever, what we are getting? Any other? So if you are, try to collect more and more example for this, okay, acute disease. You come to know what is this? Last for only short period of time. Such diseases are called as acute disease. Okay. Now we will discuss about the chronic disease. It is very chronic. What it means, chronic disease? Yes, opposite of this one. Last for long period. Sometime it will till the death that person will suffer from that disease. Once that disease got to us or as it is attacking to us, what will happen? It will remain long time. Can you give any example for chronic disease? Yes, we can take example cancers. Cancer, see this cancer is, we can consider as a chronic disease because it sometime it will take months together or else years together or else till the death it will. Okay, or else any other example, students? Polio, any other, HIV, AIDS, all those things. See, HIV or AIDS, all those things are the chronic diseases. Once it is going to attack the body, it will take more and more years to get cure. Okay, such diseases are called as chronic diseases. Now, can you differentiate this chronic and acute disease, student? Yes. Now, take your book, make two columns. In first column, write down the heading acute disease. In second column, give the heading that is a chronic disease. Now, we will differentiate these two. First point, what you will write? Yeah, these disease acute means in first column acute disease. Acute diseases are short time disease. Whereas last for how many days or weeks it is, okay. So, they are short duration diseases, short time disease, lasting shortly it will get cure. Okay, what about the chronic? Long lasting disease it is, long lasting, it will take months together, years together or else till the death it will carry. Okay, any other difference? Yes, if once we got common cold or else common fever, after 1 week get cured, what will happen next? 1 or 2 days, the feeling, tiredness, all those things will remain. After a week, what will happen? You will recover completely, right? You will come to the school once again. So, see what happened? It will recover completely after the cure. Yes? What about in chronic? Yeah. Once the person she got or else he got diabetes, sugar patient, what we are saying, what happened to his body? Yeah, continuously it is carrying, that is a long lasting. Whereas it is a cancer, what will happen? It will, number of days it will take together. So what will happen to his body? Yes, his body may get damaged because of the damage of organs or cells, tissues, organ system. What will happen to him? Does not recover completely. Sometimes does not recover completely. In some cases it is okay, or else what will happen if a disease like TB diseases. Have you heard about that? Tuberculosis. See, this is one of the disease causing for the respiratory tract disease. It will cause different problems to the respiratory system. So what happened to that one? Once we got the respiratory tract problem, surely it will continue for many days or many years, many months, many years, sometime till the death it will carry. See, this is a main difference. So what happened here? It does not recover completely. Write down that point, okay, under the chronic diseases. So come to know now what is about the recovery. If it is acute disease, nothing will happen to us after the recovery of that, or else after getting cure, what will happen? We will normal like as before. Okay. Next we will see about the weight. If you got fever or else common cold, common cough or anything, what will happen to your the body weight? Whether you change much difference in your body? No. If you got fever means because of if we can't eat anything, that time we are feeling some symptoms, and because of the high fever we can't eat anything. So after a week it is get cure, you will become normal, right? Your body weight does not change much. If 1 or else half kg is reduced or else like that. Okay. But in case of chronic disease, what will happen? Once that person sees a diabetic patient or else TB patient or else any cancer patient, what happened to her body or else what happened to his body? Yes, once the body got or else the organs got damaged means what happened? Continuously there is a loss of weight. Finally, the weight will loss, loss or not gaining, losing, it will kgs it may loss. Okay, that is the main difference here. If it is acute disease means what will happen? Nothing will happen to, no more changes to the weight, but in the chronic disease the weight, body weight will change, or the result is it will loss. Okay, body loss, weight loss. Okay. Next one, what about the tiredness and tiredness? If you are getting any disease, surely will get the tiredness. If it is a common fever what you got, 1 week we will get the tiredness. Surely 1 week because of the illness, upon that symptoms different. If it is a runny nose, if it is a common cold, runny nose means you know that how much disturbance it is. So what happened? We can't eat properly, we can't drink water properly. Because of that, we will feel tired. Few days, only few days we will feel tired. But in chronic disease, what will happen? Numbers of years together, as a months together. Full month you can't eat anything, you will feel very tired, you are suffering from the diseases, going hospital, coming back like that. So take the feeling tiredness, how much tired you may be or as the person may be. Yeah, the tiredness is also more feeling of tiredness. After the recovery also, it will long time it will last. Okay, in chronic disease what will happen? After the recovery, nothing will happen to your tiredness, no tiredness, nothing. Okay, you are normal as before. Okay, last one more point, student. What about the work and efficiency in acute disease? Surely in acute disease, loss of work and efficiency is very short. So one thing I will tell you, student, if 1 day or else 2 days you are taking leave to your school, if it is a chronic disease, you have to take leave. That is, if you got any tuberculosis means what will happen? Yeah, will take months together you have to take a leave. So what will happen? Work and efficiency is very high. Loss of work and efficiency is very high in case of chronic disease. So these are the main difference between the acute and chronic disease. In exam they will ask about this. Now we will discuss about the causes of diseases. What are the different causes? Causes of diseases. Yeah. So now tell me student, what are the different causes of diseases? Different ways. Causes means different from how we are getting diseases. Different ways from where we are getting the diseases. How we are getting the diseases. Okay, we will discuss one by one. First one, uncleaned water, or else uncleaned dirty water, uncleaned air it may be, or else uncleaned soil, land it may be, or else uncleaned food it may be. See, because of the unclean of these water, air, soil, or else food, surely we will get the diseases. We will take one example. If you are going to take dirty water, dirty means actually it is full with pathogens. Okay, in summer season we can see more and more such a problems, because the water, you know that what happens to the water in the summer season. That time what happens? We are eating that dirty water, or else the unclean, or else pathogen fully filled with that water, means what will happen to us? Surely we will get the diseases. If you are going to boil nicely means nothing will happen to us. But what happen if you are like that, and if you are drinking means surely we will get the diseases. One more thing, because of the nourishment. What it means, nourishment means? Yeah, because of the deficiency of proteins, because of the deficiency of carbohydrate, deficiency of proteins, vitamins, amino acids, all those things, fat, lipids. If it is more means also sometime it is dangerous. You know that if it is a glucose level, carbohydrate level is more means also it is dangerous. If it is less means also it is dangerous to our health. So you have to maintain the balanced diet. We have to maintain the balanced diet, that is nourishment. Different diseases, there are different diseases. See, like what, rickets, scurvy, many diseases are there. Xerophthalmia, night blindness, color blindness, all those things that is related to the nourishment because of the vitamin, proteins, all those things. Upon that, anemia, that is a famous one, anemia because of the deficiency of iron. Okay, these are because of the nourishment, causes of diseases because of the nourishment. Okay, one more is the genetic differences. Do you know what is a genetic material? Yes, we studied in our lower class, genetic material is a DNA, RNA and DNA. If any changes in the genetic material, the genetic sequence, that is the RNA or as DNA sequence is going to change. Any mutation in that means what will happen? Surely will get the diseases. One example I will say you student, that is a cancer. Actually this cancer means nothing but it is a normal cell what we have, same as that cell. What happen? If our normal cell is going to change its genetic makeup or else genetic material, what will happen to that? There is a genetic difference, or else in RNA or else DNA it is changed its genetic sequence or else nitrogenous base sequence. So what will happen to that cell? It turns as a cancer cell. Before it was a normal cell. Now what happened? Because of the difference there, we are calling it as a mutation. Because of the mutation, our normal cell is turns to what? A cancer cell. You know that how fastly our cell is going to division, cell division we studied in our lower class. So what happened to the cell division? When the normal cell, if it is controlled by our nervous system, upon that our brain, so it is controlling, the brain is a controlling point, it is going to control each cell. All the cells are controlled under by this brain. So these cancer cells, they are different from our normal cell. So it is not going to control by brain. So what will happen? Uncontrollingly it is dividing, unknowingly it is dividing rapidly. It will number of divisions takes place very fast. There is a number of cells, younger cells will generate. So finally there is a formation of tumor, what we are saying. Okay. Later it turns as a cancer. Okay, we are calling it as a cancer. So that is because of the genetic difference. Time genetic abnormality, this is also one of the causes of diseases. Do you know what is genetic abnormality? See here, have you heard about the Down syndrome? See, many diseases are there, Down syndrome, like that. So what will happen to that one? Because of the abnormality in the genetic material, people or the young infant or baby, there is a chance of getting the diseases. So these are the different causes of diseases. Next we will discuss about based on the causes of diseases, it is further divided into two types. Okay, they are non-infectious diseases and infectious diseases. I will write here. See, first one, non-infectious, and one more is infectious. Yes. Now we will discuss, student, what is this non-infectious and infectious. This classification is based on the causes of diseases. Okay, keep it in your mind, causes of diseases. This is based on the time duration, by seeing the time, how many time it will lead. Okay, it will take that time, because of, by seeing that one there are two. Here what happened, based on the causes of diseases, this is divided into two types, that is non-infectious and infectious. See, we will discuss about this. First we will discuss about the non-infectious. See here, there is no agent for these diseases. There is no agent. No agents are responsible, or else no pathogens are responsible for such a diseases. Means we are calling that is a non-infectious diseases. Can you give any example? Yes, just before I said about the cancer. See here, no one is responsible, no agent is responsible for this disease. Okay, because of the mutation in the cell, getting the cell is converted as a cancer cell. See, that is an example for non-infectious diseases. One more, I will say, students, change in the BP level. What is BP? Yes, blood pressure. Changes in the blood pressure, if it is low or high, that is because of no any pathogens, as it is because of our body changes, or else in the pressure created in the heart, or else in the capillaries, blood capillaries, we are getting that, the person is getting that disease. That is also comes under non-infectious disease. One more is a genetic abnormality, whatever I have said, what a Down syndrome, all those things. Okay, these all are the non-infectious diseases. Diabetes also we can include. Infectious diseases means what? Infectious diseases. Here what happened? Some organisms like microbes, that is the pathogens, are responsible for these diseases. They are called as infectious diseases. Come to know here? Some organisms are responsible for these diseases. Because of that pathogen we are getting diseases. Can you give any example? Yes, malaria. Because of which pathogen we are getting malaria? Yes, Plasmodium, that is one of the protozoa. AIDS, HIV, because of the virus we are getting. Typhoid, because of the bacteria, typhoid bacteria. Salmonella typhoides. See, these are the paratyphi, number of examples we can see. The polio, nowadays the coronavirus, that is because of the infectious agents. Come to know, these are the diseases responsible, because of that pathogens we are getting the diseases, either bacteria, virus, fungus. If it is a ringworm, what we are saying, we are getting the white patches in our skin. If it is a pus formation in our thumb, these all are the fungus diseases. See, these all are the infectious diseases. Now, the infectious diseases spread by agents are called as communicable diseases. In exam, They will ask about the communicable diseases. What it means? Communicable diseases means the infectious diseases spread by agent. Write down that point. The infectious diseases spread by agent are called as communicable diseases. Okay, what it means? What it means? Some agents or else some pathogens are responsible for such a diseases are called as communicable diseases. Now tell me, what is non-communicable? Yes, you can tell the definition. Next, one more classification we will see, student. Mean of spreading, by spreading the infectious diseases. These infectious diseases, okay, the way of spreading it, okay, according to that they are classified into 4 types. Okay, 4 types we can see. I will write somewhere here. So you can see, see here I will write the mean of spreading of infectious diseases. Based on that one, further classification, type of diseases and examples I will say you, student. Take your book along with me how to write. Okay, first one, airborne diseases. Type of disease, here I will write the type. Okay, first one is airborne disease. Okay, airborne disease it is. What it means, airborne diseases? It is spreading. This is an infectious diseases only, but what happened? Because of the air, what happened? It is going to spread from one person to another, or as one individual to another, or as one organism to another organism. See, these are the airborne diseases spreading through air. Can you give example? A simple example we can take common cold. What happened in your class? Today one boy got common cold. Next day we can see 2 or more boys, they are suffering from same diseases. After a week we can see full class it is spread. See, this is a airborne diseases. So how we can avoid this one? You have to keep your handkerchief along with you. If you are getting sneezing or coughing, you have to use your handkerchief, or else you have to use your, at least if you don't have the handkerchief, use your hand, after that you wash it. Okay, this is one of the airborne. What will happen? If you are going to sneeze, the microbes, the pathogens will spread into air, mix with air, and it will pass to the another person. When he is breathing the air, what will happen? Inhaling the air, what will happen? It will enter his body. So it will spread very soon. Okay, one more example, pneumonia. You heard about the pneumonia, right? Yes, that is also related to the respiratory tract disease. It is tuberculosis. All those things are the airborne diseases. So one person is suffering from that means there is a chance of spreading by air. Okay, so we have to some of the precautions or measures what it is there to avoid that one, we have to follow that one. Okay, next one is waterborne disease. So waterborne disease, what it means? Yeah, this disease, this is an infectious disease. This disease can spread by water. Can you give one example? Typhoid. Best example we can say, that is a typhoid. If typhoid, that is a bacteria called Salmonella typhi, that is the scientific name of that one, Salmonella typhi. That bacteria, it is there in our well water, means surely our whole family member will get that disease. So what we have to do? We have to boil the water and then you drink. Okay, same as that cholera, you know that how it is spreading, hepatitis. But nowadays we are getting the vaccines, antibiotics and different drugs, medicines we are getting to overcome this one. But these are some of the methods how it is transmitting. Third one is sexual diseases. Okay, sexual diseases or else disease. Now what it means? In sexual disease, it is spreading from one person to, or else transmitting from one person to another person because of the sexual intercourse or sexual contraction. sexual contact. Okay, if one disease, if like HIV or else AIDS or else syphilis, gonorrhea, chlamydia, many diseases are there, student. See, if it is AIDS, if it is present in husband, means there is a chance of spreading to his wife because of the sexual contact. This is one of the disease. These are the diseases spread through sexual contact, that is called as sexual diseases. So, how we can overcome this one? Yes, there are some rules and regulations, the precautions method. So, we can follow that one. Okay. Next one is fourth one, animal-borne disease. Animal-borne disease. What it means, animal-borne disease? Some animals are responsible for this disease. So, what happened here? Animals are responsible for the transmission of diseases from one person to another person, or else one organism to another organism. One example I will say, student, simple example, rabies. If one organism, that is a dog, so dog is suffering from this rabies disease, what happened? Unknowingly dog bite to a person. What happened to that time? These organism, rabies virus it is, so it will spread, there is a chance of spreading rabies virus from one organism to another. Okay, that is from dog to a man. So, what happened? Because of the interference of animal, it is going to spread or else transmit. One more, mosquito carrying malarial parasite. What happened? Because of the mosquito bite. Many things are there. If it is a CC fly, many things are there. See, these are the some of the diseases. What happens here? These diseases are transmitting from one person or as one organism to another. There is an interference of animal. So, it is called as animal-borne diseases. So, there is a medicine, anti-rabies we are getting. See, we can use, still medicines are there for the malaria also, we can get the different medicines. So, but still we have to take care of the animals also while we are, if it is a pet animal means also while we are you have to take care while you are treating that one, because we do not know that whether these organisms are having or suffering from disease. If it is what rat fever is common nowadays, it is present in the skin and urine of the rat. What happens is that pathogen, there is a chance of attacking us, that is also an animal-borne disease. So, add more and more example to this one, students, we will get number of example. So, we will finish off today. Yes, we just will recall what we have studied in today's class. Yes. First, we studied about the difference between the health and disease. What is a healthy person? The person who is suffering from the disease. Much difference we can see in both. Healthy person, always he is happy, always is mentally, socially, physically he is good. But what happen in diseased person? Always he is unhappy because he is suffering from some disease. Uncomfortable, disturbed case, if it is in mental, physical or socially. Okay. Yes, next we studied about the how we are getting the diseases. So, we come to know that after studying this much, we come to know that why do we fall ill. The solution for the heading, this is actually a question mark. How do we fall ill? See, we got the solution. How do we fall ill? Because of the pathogen sometime, because of the water, because of the air, because of the sexual contact, because of the animals, we will get the diseases. So, these are the things. After that, we studied about the two types based on the time duration, that is acute and chronic disease. With examples we discussed. Later we discussed about the causes of diseases, different causes we discussed, how we are getting diseases. Based on the causes of diseases, there are two types, that is non-infectious and infectious. With examples we discussed about that. In exam they will ask you to write or else differentiate infectious and non-infectious diseases. Last, we come to know that what is communicable diseases and types of diseases and examples. Okay, write down today's question, student. Differentiate acute and chronic diseases. Yes. Next, one more question. Give example for airborne diseases, waterborne diseases, sexual transmitting diseases, animal borne diseases. Okay. Define the term. Third question. Define the term communicable diseases. Okay. Last, one more question. Write a short note on infectious disease with example. Okay, what is infectious disease and examples you have to mention. Thank you, students.